Hello, everyone. Can you hear me? Yeah, you guys are a very intelligent crowd, I could tell. So I will keep my sessions short and we'll keep more time for questions, if that makes sense. Okay. So yeah, I'm Siddharth. I work at GE Healthcare. I'll tell you about what I do. Um, so I swear I was looking for this T-shirt today, okay, because the GeekyAnts folks hadn't met me. So I thought, okay, I need to wear this so that they let me in. Thankfully, they let me in with this T-shirt too. So it was out drying in the balcony, so I couldn't wear that. Yeah, quickly about me. So I've worked at GE Healthcare. I guess all of you would be familiar. It's an $18 billion revenue company. We touch about 1 billion patients, billion with a B, patients every day with our devices, applications. So these devices are across the entire product range, starts with like imaging, goes into monitoring, anesthesia, respiratory care. You enter a hospital, any device you see is probably, we make it, not that it's made everywhere by us, but yeah, we make it, so that's what GE does. About me, so I work as an AI product manager. Actually, before that, quick survey, okay? So how many of you here are data scientists? Show of hands. Okay, not bad. Any clinicians here? Doctors? Okay, you're a doctor. Okay, what area? Neuro anesthesia. And how about you, sir? Okay, okay. You're not a practicing doctor, but okay, okay. That's great, okay. Product managers, okay, nice. The rest are engineers, I'm guessing. Can you raise your hand, engineers? Okay. Any other, role I've missed out on? Okay, okay. You can see that I'm an engineer too. We're all engineers, so businessman, wow. He's the most important person in the room, by the way. Huh? He's got the most money, so. Any other role I missed out? Okay, you're in consulting. Okay, nice, interesting, huh? Okay, another thing I wanted to ask you is how many of you work in healthcare? Almost everyone. How many of you work in medical devices? Anybody medical devices? That's nice, not bad, huh? Health apps, therapeutics, digital therapeutics. Not bad, okay. So collectively, this crowd knows a lot more than I do. I can say that for sure, okay? So, yeah. So what do? I work as an AI product manager. So AI product management is a little different from software product management. So we work alongside data scientists mostly, and of course with engineers to deploy the applications we build, right? And there is of course a difference in what we develop, and I'll tell you more about applications that we work on. We are in this domain called precision care, which is applications that are used by clinicians at the end of the day in a hospital setting or in a primary care center, right? So which means we undergo regulatory scrutiny. So it's not that we can develop something and just deploy it. We undergo very strict regulatory scrutiny. And also the disclaimer I've given at the bottom, right? So my exposure is primarily to the US market. So a lot of what I say here will be relevant to the US market, but by extension, you could say it is true or will be true in the Indian market. So yeah, that's me. Okay, I'll keep this a little interactive, okay? So we have a doctor here. I don't want to ask him, he will know the answer, but anybody here on what is a clinical versus non-clinical algorithm, let's say? Anybody? Any guesses? What's a clinical algorithm? What's a non-clinical algorithm? Or should we go to the expert straight? Yeah, go ahead. Yeah, very close. Yeah, very close, very close, very close. Yeah, you're almost there. Anything else anybody wants to add? It's actually mentioned here, but yeah, I still. Yeah, yeah.
Anything related which is impacting the health of human beings. That's clinical.
You know, Practo will say they impact patients' health also. Is that a clinical app?
No.
It does, by the way. You're right, but yeah, so I think it's here, but I would say simple, right? So anything that a physician or a nurse or any clinician uses at the end of the day to take a decision falls into clinical. That's the simplest way to put it. So anything that a physician uses to take a decision or or a nurse uses to take a decision falls into clinical use, right? And that's where I think a lot of difference in terms of how we develop an AI algorithm comes into play. And we'll talk about the patient journey briefly. Um, it becomes a very different domain, very different territory. It requires intense research, intense development effort, intense testing, regulatory clearance, takes months, sometimes years. And after that, you go into the field. You can't do federated learning. You can't retrain your algorithm when you want to. It's another release. So there is all of that, right? So when you talk of AI product management, it's all of that. You start with development till deployment, retraining. Then do you want to do another release? What's the life cycle? You plan for the life cycle, get it out if it's not required. So all of that, right? And which is where I think a lot of clinical use case algorithms don't even make it to the market because there's so many hoops to cross that we don't even make it to the market eventually a lot of times. So that's, I think, the big difference. And I think the way we approach development also kind of changes, right? So yeah. Okay, so I just want to quickly touch upon what a patient's journey is like, right? So it's kind of shown here. Um, and before I jump into this, I quickly had a question for you. Okay, and this is the data I came across recently. Any guesses on what percentage of data generated across the globe? Okay, all data is healthcare data. So this includes everything. Okay, social media data. I don't know. Like there are like vehicles on the road. That data is captured. There's spacecrafts. There's all the data we generate every day. What percentage of that is healthcare data? Any guesses? 5%? 30%. You know it. It's 30%. 30% of all data generated is healthcare data. And I was a little baffled when I heard it for the first time, but then if you dig deeper, you realize it is true. All the data generated and captured, 30% of it is all the data that comes from our body essentially, in different forms. And we'll talk about how that data is captured, not captured, structured, not structured, all of that. But that's the volume of data we're dealing with, right? And the reason I mention that is if you look at the patient journey, nowadays what happens, and again, this is a little bit more of a US context, but this is true in India now too, is that you look at the various stages or, let's say, steps through which a patient goes through to finally get care, right? It's important to understand this journey because there are many touch points on each of these steps. And understanding these touch points, understanding the data that is captured, understanding how that data can be used, is there a clinical use for it, is there a non-clinical use for it, I think that becomes very important. Especially for, let's say, anybody, like even for a data scientist working in this domain, right? Just knowing data science will not take you too far because you'll have to understand what the context of that data is. And even for product managers, you'll have to understand why the data is important, how that can be put to use, how do we kind of even just store that data. We don't know, we may not use it today, we may use it 5 years later. Can we even track that data, right? So I don't want to go through this as right in front of you, but I'll talk a lot about stages 3 and beyond, right? So the first is, of course, there's a trigger. Let's say you take any condition, right? So let's say you have a pain in your chest. That's a trigger. You take an appointment. HCP is a healthcare provider, right? So this could be a hospital, this could be a primary care center, this could be your family doctor, or not a family doctor. Family doctor will probably refer you to an HCP. So you go there. Stage 3 onwards is where actually your physician or your or any clinician gets involved, right? And that is where I think, as practitioners in this field, we need to understand how patient data will be used. We need to start at stage 1 also, and there's a lot of great products coming out in that space. Your wearables are a good example. You're tracking data all the time, it's capturing a lot of data, and it will evolve, it will come up. But I think as practitioners, we need to understand how the data for stage 3 and beyond will be used. I was talking to somebody today, and he works in stage 6, which is ongoing care, right? Work in stage 6, right? Which is and it's for cancer patients who are recovering. So that is again important. I mean, each of these steps is important. Don't get me wrong, but I think a lot of work today is still pending, even in stage 2, 3, and 4, right? Where the physician or the nurse needs inputs from the patient data to say that, okay, this is the action that needs to be taken. Can we give predictive information on what needs to be done with the patient? So yeah, quickly I wanted to show you this. And yeah, again, three big challenges. I mean, there are a bunch of challenges. My earlier speakers have covered a lot of those challenges and all very relevant. But in my experience, I feel like these are the big three challenges, especially in the US context, right? So maybe not so much in the India context, but this may happen soon. The first one is clinician shortage. There was a survey in the US recently where 50% of nurses said that if they get a job with an equal pay elsewhere, they're willing to leave their job, right? 50%. They're overworked. They're more than 50% of their time goes into doing documentation, mundane work, routine work. And the last thing you want to do is to introduce an application without understanding the clinical workflow and getting them to do more work. It's like I replace if you're on iPhone, I give you an Android right now. It'll easily take you a few days to adjust. I mean, we're all still young and maybe we have time, but clinicians don't have time, right? The last thing they have is time. So that's a big challenge. And I think a lot of applications, products, solutions are really trying to address how we can kind of take care of that shortage. Second one is extensive data. I was just chatting earlier. There is data, there is patient data available. It's not structured, it's not accessible. There are no common protocols for a lot of things. There are there is the HL7 protocol and things like that for devices, but we don't have common protocols for storing data. So yeah, you were just giving the example earlier that I went for an appointment to an Apollo hospital, for example. Now, can I go to another hospital and will that data be available to that doctor? We don't have those systems in place yet. In the US, they still have EMRs which can share data across hospitals. We have EMRs in India too, and to be honest, I'm not aware how good those are. Maybe those are very good, and some of our friends here can, they work in this domain, they will know. But I think getting extensive data, exhaustive data is a challenge, right? And again, I go back to the chest pain example. Can a doctor today know what the history of this patient has been, even if it's basic data from your Apple Watch, right? Can you get that data? Today, that's not available. Making that available itself is a big challenge. And third one is kind of related to the second one. How do you manage ongoing basis kind of manage a patient, right? So data is one part of it, but also how do you ensure that there is continuity in care? And that is another challenge. So you might intervene at one point. Let's say today we are all coming up with point solutions, right? So there's an app, for example, at stage 6 where somebody is done with let's say surgery, they've come out, they've gone home to take care of their recovery after that. There might be another set of solutions before that. Is there a continuity in these? Not today, but that's another big challenge that you'll have to think of. Now, again, so this is something I've kind of seen in my experience at GE. There are two big trends, right? Two big shifts happening as a result of AI and data coming in. And not just because of that, I think in general, human nature, the pandemic played a role in it also. There's two big changes happening at this point, right? So here on the x-axis is how personalized your care is, and on the y-axis is intervention, which is, and I'll tell you what acute care is and preventive care is. Acute, yeah. So let me just actually show you that. So right now, let's say we are here, right? So we are providing standard care for most conditions, treatments, and it's acute. Acute meaning you need to go to a certain healthcare provider, you need to go to a hospital, you need to visit a doctor to get that care. From where there we are moving to precision care and being preventive, right? So precision would be, of course, highly personalized to what your condition is, what your history has been like, and being preventive in nature, which means that we ensure that we catch the condition before it even evolves and becomes big. So that's one big shift that is happening, and most not just device companies, healthcare companies are kind of aware of this, cognizant of this. They are moving in this direction. And the other big shift is location and visits, right? So on the x-axis, you have the physical location of where the intervention is happening. Today, it is happening primarily at primary care centers or hospitals, right? PCC here is primary care center, and the number of visits is high. We are moving in this direction, and here the pandemic had a role to play because you didn't have a choice. You had to seek whatever help you wanted at home, and for a lot of things, not for everything, of course. But what will happen in time, and as device companies, we also think about how many of these devices are getting miniaturized. I don't think anybody even knew what a pulse oximeter is that what it's called. Nobody knew what that was before the pandemic. Today probably everyone has one at home, or you have it in your wearable, right? That's an example of how many miniaturized devices will start showing up either as part of your wearable or separately. And especially, let's say now with my parents' generation, for example, right? I remember like my grandfather, he's no more now. He had to go to a primary care center every time to get his BP checked. This was maybe 25, 30 years back. Today, my parents don't have to do that. And my mom is diabetic. She doesn't need to go anywhere to get her blood checked, blood sugar level checked, right? She does it at home. She has a device for it. That's the direction in which we are moving, where a lot of monitoring, a lot of prevention will happen at home. There will be miniaturized apps, devices, all of that will play a role. And which of course means that the number of visits that you make to a healthcare provider, to a doctor, primary care center, that's going to go down. So these are the two big shifts that I think most players in this field are cognizant of and they're working towards. Okay, so like I mentioned, these are the four things that are happening, right? So from the previous trends. Now, what does personalized care mean? It means you need to have detailed patient data and history, right? So that's the implication from this. If it's preventive, it means that we need to have detailed study of conditions, research on. So, for example, can we catch? I don't want to do the example of cancer, but any other condition, right? Can we catch a heart condition before it even happens? Can we detect it? Let's say 1 year in advance, 6 months in advance, or even 2 months in advance, right? That itself is something that would be an achievement. So that would be a step in the direction of being preventive as opposed to being reactive. Home focused, of course, I mentioned. We need smaller devices, more efficient apps, more efficient information. I was earlier kind of taking a dig at Practo, but actually they're providing this, right? So that you don't need to go out for smaller things. You can actually just consult the right an expert right at your home and get the information you need. You don't need to be anxious about what's happening and wait for your turn, go and meet a doctor. So you can do that sitting at home today. So that is again something that will happen and is already happening. Yeah, monitoring is again, like I mentioned, we have limited monitoring today. Just sort of curiosity, how many of you have a wearable device, smartwatch? And out of you, how many of you regularly track your heart rates and different stuff, different healthcare data? Not bad. How many of you work out at least 3 days in a week? Not bad. This is a very physically active crowd. Okay. So that's good. Now, all of this would mean, right? It means a lot of data. And I was talking about 30% earlier. Now, this 30%, my data science friends here will tell you is junk unless it's stored properly and it's not structured. And it's not structured. I can tell you that for sure. Even the most structured data sets are not structured. So you can imagine what happens with. So quick, okay, again, to the data scientists, okay. What percentage of your time do you spend on data engineering, just getting the data set right? 70, 90. Any other 70, 90? It's not less than 50, I'm guessing, right? Yeah. So your problem is as much as that of the clinicians. They spend 50% of the time doing documentation. You spend more than 50% of the time structuring the data. So you know now where the gap is, right? This data is good, but this data has to be structured. And another thing I was briefly discussing with somebody in the break is we are now coming up with protocols. We don't even have common protocols for data, for devices. Devices we do actually, but let's say in countries where it's not, there's no protocol or there are devices that are ad hoc in nature. You might get your ECG from one device, and then I don't know if that data can actually be transferred to another EMR in another hospital. So that is again something that is being figured out. A lot of it has been figured out in some of the advanced economies and countries. I'm not sure how the situation is in India, but that's something that will have to happen for AI to even happen, right? Then comes the intelligence. After you do all this, after our data science friends sit and structure the data, we start with looking at if there's some intelligence possible in that, right? So can you draw some trends out, what you can do, what are some of the techniques you can use, etc. And then come up with insights. Finally, after all this, you come up with insights that you can share with either the clinician or with the hospital, depending on the use case, or with the patient. So I think the if I have to summarize what the data and AI challenge in healthcare is, it is this. We have data, the data needs to be structured, then you add intelligence to it, and then you come up with insights. So I think the base of the pyramid here itself needs to, first we need to get the data, and then after that the second level, right? So that's the bigger challenge at this point in time. Yeah, I've just shown some use cases here. I just wanted to give some examples of what all happens with some of the data that you can use. But again, doing all of this, doing drug discovery requires you to have that kind of a data set. And we can take some, I was one of the earlier speakers was answering a question on getting data from hospitals, right? I can give a 2-hour talk on that. It is a big challenge getting, especially with US hospitals. It's a big challenge because compliance is one part of the story, getting agreements is another part of the story. And these are long drawn out processes. Thankfully I work for a large company which has the resources for this. Smaller companies, startups really struggle. In the US I'm talking about. In India it might be a little easier, and that makes it tougher, right? So as an entrepreneur, if you want to develop something, I think it's really tough to just get your hands on real data. So my suggestion would be start off with existing data sets that you find on the internet, prove a concept, then go and try to get data, as opposed to waiting for the data to come, because that might even never happen. So yeah, I wanted to end with this quote. I love this book. I love this quote. And I'll read it out for you. So it says, the promise of AI in medicine is to provide composite panoramic views of individuals' medical data, to improve decision making, to avoid errors such as misdiagnosis and unnecessary procedures, to help in the ordering and interpretation of appropriate tests, and to recommend treatment. If I have to summarize what AI can do in healthcare, or what AI should do in healthcare, this is it. How do we get here? Yeah, let's all sit and brainstorm. It's not an easy problem. It's not an easy challenge to solve. But again, there are a lot of companies, large companies, small companies, startups, taking up smaller use cases, trying to solve those. Because solving the big piece is always challenging. It's better to take smaller point solutions, start with that, and see how you can take it forward, right? So, yep, I'm at the end of what I had to say. Happy to take any questions if you have any. So, yeah, over to you.